back with Dr. Zhitnitsky. Let's talk about sedation dentistry. We hear lots about it. We know lots of people have worry about dentistry, and they're afraid, and that's a good way to kind of sleep through. But most of us don't understand it, and also I think very few people understand that it's not only for the cowards, the dental cowards. It's also for people who are busy business people, or just, who isn't, right? But people who say, I want to go to the dentist once instead of 9 times, and I'll be done. I'm not afraid of him, but, how can that be done? So anyway, tell us all about sedation dentistry, which I think you're doing in your practice.
Yes. About 85 million Americans are afraid to go to the dentist. And they keep putting things off, and their conditions worsen, and they wind up getting more treatment done than if they would have had regular exams. Now, people are afraid of needles. People don't like the drilling. Oral sedation gives you a very, very safe way to sleep through your appointment. You don't remember anything. You're completely relaxed. We can reverse years of neglect in a matter of hours. There's
Let me ask you, so this is wonderful, but while the patient is, so to say, doesn't remember anything, but he's not unconscious like for appendix operation, is he?
Oh, no. These patients are in and out of sleep. They're very, very relaxed. Some periods they may be sleeping, some periods they may be waking up. We talk to them. They don't remember a lot, but they're completely comfortable. There's no pain. There's absolutely no anxiety. The whole point of it is complete relaxation.
I see. So it looks to me like, for instance, even if I just get a cleaning, and usually I sit there for an hour, I get my injection most of the time, which probably means I have a slightly more deep scale cleaning. Anyway, it's not hurting, it doesn't do anything, but it is actually annoying to keep the mouth open for an hour. So you start counting sheeps, when is he done with it? You go, okay, I think he's halfway through here and this, and I start calculating, being an Encino, and I go, I think you'll be done in 20 minutes or this, simply because that's me. So that must be a big advantage if time just flies for the patient, if he doesn't even know he's there.
Oh, absolutely. There are a lot of people who are busy, have hard work schedules, that don't have a chance to go to the dentist on a weekly basis to get their treatment done. This is a very good opportunity for them just to be relaxed and sleep and have 4 or 5 appointments done in one sitting.
Wow. So, now, are there any side effects? Are there any, like normal anesthesia, on an average you do want to stay away from it, because that could, you always have to sign those many forms and stuff, which is understandable. You need to do that for crossing the street these days. But what, give us, are there any side effects?
Medication that we use has been used hundreds and thousands of times since the 1970s, so it's 100% safe. Patients are hooked up to a hospital-grade pulse oximeter where we measure their blood pressure, respiration, oxygenation level. They're completely safe. We have reversal agents available that can take them out of sleep in a matter of 3 seconds. So there has never, ever been an instance with a technique that we use that somebody has suffered any adverse effects.
And no side effects.
If I can mention one more thing, Helmut.
Yes.
There are some people, a certain percentage of the population, really don't like to go to the dentist, not because they're afraid, but because they can't get sufficiently numb. Local anesthetic doesn't work on them. Mm-hmm. Every time they have a procedure, it's painful. Mm-hmm. So they have to grab the chair and suffer through it. Mm-hmm. The added advantage...
Wait a minute. Doesn't everybody have to grab the chair?
No.
I thought that was standard procedures. I always do that.
Absolutely. No, not all patients. When you're relaxed and you're comfortable, you don't have to grab anything. So those people who cannot get adequately numb, they get adequately numb when they're under sedation.
I see. So it bypasses the local anesthesia not working. It bypasses that.
Yes, because there are two aspects of local anesthesia. There is how it gets your nerves numb and how your brain interprets pain. And it helps your brain not interpret as much pain. That's why you get more numb, and that's why you don't feel any procedures while you're getting sedated.
Wonderful. So again, back to the question. So there's no danger of basically going in an infinitive type of coma. But so you said that people kind of don't remember what happened. So that doesn't disturb their life, that all of a sudden they have like a gap there, or they don't know they have a gap because they don't remember, right? I don't know. So what I'm saying is no long-term side effects. Like even if you take aspirin for the rest of your life, chances are you have long-term side effects. Maybe I'm wrong, but
no, this is much safer than aspirin. What happens is that you're scheduled for a procedure where you come in the morning, you have your sedation appointment, and then you're being driven home to rest. And the rest of the day, you sleep, you eat, you relax, and the next morning you have your business as usual. You go to work or school or whatever that is you do.
So don't drive heavy machinery right after the appointment, that's for sure.
Absolutely not. Absolutely not.
So, and I'm sure you have some type of arrangements there with patients to make sure they get home.
Oh, absolutely. Everything we take care of the patient from start to finish. We make sure there is somebody to bring them in. Somebody will take them home and keep an eye on them and feed them and make sure they're comfortable.
Now, what about a patient who does this long, it's probably a stupid question, but so he does this like 5-6 hour appointment. I mean, he needs to go to the bathroom and stuff. Can he do that?
Oh, absolutely, absolutely. We get up, we go to the bathroom, we sit back down, and we continue our treatment. You are not completely out. It is not like general anesthetic where you stop breathing. It is not like IV sedation when you can't get up and you have to have a catheter. A patient actually talks to me. If they have a problem, they tell me. I talk to them. We're communicating, but they're just so relaxed that they really, really don't care.
Beautiful. I love it. Thank you very much. And, hopefully that will get actually lots of people more dental treatment done due to the fact they don't have to go so often, whether they're scared or not. If they're scared, they can go. It's less pain. And, if you're sitting in, it's the sitting in. Once you're sitting in, it's fine. But then if you can sit in several hours and get lots of it done, that could only be an advantage. Absolutely wonderful. Thank you very much.
Thank you very much, Al.